Hello, Peterson Health family and Hill Country community. My name is Cory Edmondson, President and CEO of Peterson Health. I'm excited to share with you about our journey in fiscal year 20 and the successes and highlights that we experienced. I tried to come up with one word that summed up the year, and it was eventful. And as you can imagine, with COVID-19 and all the things that went along with being the new CEO of Peterson Health, it was eventful. Some people might say that I wish 2020 would go away or I wish it would stop or whatever, but not at Peterson. In fact, Peterson is positively Peterson. We look forward through the windshield of where we're going, and we like to reflect on our past because it tells us our journey and where we've been. So follow me. Let's go inside and let me share with you what's going on at Peterson Health. Let's start with the obvious, COVID-19. COVID-19 caught us all by surprise, but Peterson Health quickly sprang into action and set up our hospital incident command system. We chose to do that in order to manage better communication and make sure everybody was aligned with what we were doing, starting with screening people when they walked through the door, making sure that they social distance, that they scrubbed their hands, that they put masks on, and we took their temperatures. We did all of those things. We chose to manage COVID and not let it manage us. We chose to face COVID-19 head on. We had to make some difficult decisions as well that weren't easy, but we chose to continue our mission of providing exceptional, compassionate, patient-centered care. We planned ahead in a variety of ways, including providing PPE to our staff to make sure that they were never in jeopardy and were safe to take care of patients. Additionally, we set up the Joint Operations Center with the city, the county, the independent school districts, and Shriner to jointly work together to help the community to navigate this pandemic. We gave public announcements, we did press announcements, the whole works. Communication was key in what we did as an organization and with the community. We also established a web presence that was all things COVID-19, so way to go web. Over 44,000 hits a month for people to access us for resources for COVID-19. We also set up a call center that was manned by nurses that was answering 100 calls a day. We set up telemedicine where we were able to do virtual visits at home with patients who were fearful of coming in. We were trying to figure out a way how to take care of patients remotely. In less than 48 hours, our urgent care center set up a way to treat and test and screen patients for COVID-19. Way to go, Urgent Care Center. And thank you, community. You supported us through all of this. There was so much. This is just an example of all the things that we did and were accomplished, and this is just a highlight. But our community supported us, gave us food, sponsored us, helped us out to uplift our spirits in what we did. They were truly elevating us as we were trying to elevate the community. So we're still smiling behind our mask when you see us at Peterson, but that's just a sample of COVID-19 and how it impacted us as an organization. In spite of COVID-19, there's much to celebrate and we're so thankful for. We're positively Peterson. Yes, that's a play on words, but we are positive about the accolades and the things that were happening here at Peterson. And the awards show it. They just poured in. For example, in April, we received the highest quality award from the state of Texas. We were one of 3 in the state to receive that. That's all about quality. That was a journey that we achieved this year. Additionally, we achieved Leapfrog A rating, which is the second time this year. It's the highest safety rating that can be achieved. Overall, patients rated us very high. We are in the top 13% of hospitals nationally. For 5 years in a row now, we've received top 100 rural hospitals in the country. And what was exciting was Newsweek magazine rated us best maternity hospital. We were 1 of 7 in the state of Texas. Imagine how many hospitals are in the state. We were 1 of 7. Very exciting news. That automatically came our way just because of the quality and the things that we do. We received Women's Choice Awards for patient safety, experience, and orthopedics. The Kerrville Daily Times rated our hospice agency and home health agency #1 in the city. We were ranked top 10% of hospitals in the nation for cleanliness. We're a safe and clean facility in all of our buildings. We achieved Acute Stroke Ready certification. We're ready for any stroke or things that come through our emergency department. Additional to that, we received PCI designation for heart attacks. Our cath lab and our heart team and our cardiovascular team are ready for emergencies. We also received a Safe Sleep certification for our baby place. These designations may seem medical and meaningless to the general public, but what it does is validate that our already quality staff is providing excellence and high level of care and safety to the public and to our patients and setting Peterson Health apart. Another thing that sets us apart are our employees and our board of directors. We did an employee engagement survey right in the middle of COVID in July. I'm excited to report to you that we had an employee engagement result of 91%, meaning we are in the top 9% of other organizations who have an engaged employee staff. We had a 92% participation rate as well, which was phenomenal. Talking about our employees, our Employee of the Year, congratulations to Audrey Ben David. And our Excellence in Leadership Award went to Cory Edmondson and to Amy Ives. Congratulations to two strong leaders. Now our board of directors. People don't realize how important they are to this organization, and they are very engaged in what we're doing. We're pleased to announce two new board members this year. It's Tom Howdeshell and Sylvia Fritz Dobbs. They do a phenomenal job in joining our board this year, and congratulations to them. We're happy to have them join us. Now let's talk about strategy and growth. About a year ago, our board met with our foundation, the medical executive committee, and the leaders of Peterson Health for a day and a half to go over what our strategic vision would be. We discovered 5 things. 1, our initiatives. They were team, exceptional care, growth, stewardship and sustainability, and healthy community. Those are our 5 initiatives moving forward. It all ties back to our mission, vision, and values of the organization, meaning all the decisions that we make tie back to that as an organization. Now let's talk about growth. Physician recruitment was paramount to our success. All of these are leaders and new to our medical staff that we're excited to have on board. Next is growing regionally. We're not just a stagnant organization, we are on the move. In fact, we became regional in Comfort, Texas. We opened up physical therapy and family medicine in that community. We're excited to be there and to support them. In spite of COVID-19, we still invested in our facilities and technology with ultraviolet lights that helps with disinfecting our rooms and areas of the hospital to make it safer, and vital sign equipment, MobiLab equipment to help our lab facilities, cardiac ultrasound units, and we upgraded OR lights in our operating rooms and in labor and delivery for safer, effective care. We continue to invest in the best technology and what is best for our patients. We talk about investment in our facilities, we also invest in our community. In particular, it's the Build Health Initiative. We are supporting the Doyle community to a tune of $300,000 over the next 2 to 2.5 years. We're supporting that community and working with other nonprofits in that area to have a clinic, to do education, to do screenings, to elevate them to better health for their future. We're hoping to change generations to come. So overall, how did we do? I like to look at statistics to tell me and give me an indication of that. And just a few examples. Our occupancy rate and admission rates were up. Our cardiac cath procedures and all the things cardiac were up almost 50%. Deliveries were up by 6.5%, but our ER visits were down by over 8%. That was the way it was across the nation. But here at Peterson, we were seeing sicker patients with a lower volume. It's because people were delaying care. They were scared to come into the hospital because they were fear of getting COVID. Let me assure you, we are safer and cleaner than ever before. Please don't delay your care. It can have long-term effects, and we want to see you and take care of you. So I've just been able to share with you our successes, some highlights, statistics, all that go with that. And it's just a small example of who we are, where we've been, and where we're going. So we're here for you. I'm proud to say that we are stable, confident, and have clarity for our future. Our focus is forward. Thank you, Kerrville, and thank you, Hill Country community, for your support.